So I want to shift, and this is obviously really probably the most important part of the program. Finishing up FY10, I wanted to thank you all for your tremendous efforts. But this is an exciting new world. I showed you the fiscal 11 objectives, and the third one on there is the AF solutions area. This is a new space. Really, David Steinhaus and Reggie a while back kicked off a whole strategy about what do we do about AF, and this was a couple years ago. They went through a whole process, which led to us acquiring Cryocath, acquiring Ablation Frontiers, integrating our EP Systems business. And in the course of 18 months, we have built a 600-person organization. We're about to launch 2 products in the US and build a $200 million business with a growth rate of 60-some% on our way to $1 billion business. The most important part of that is all going to deliver this life-saving therapy and life-changing therapy to patients. So this is a new product for us, and you're going to get a chance to actually see the Arctic Front. I'll show you a quick video here, and then you get to hear from a family, actually the daughter of the patient, and then you get to hear from the patient himself. So maybe we can run the cryo video. So I can do I'll try to do my best narrating. So the cryo balloon is pretty much what it's described. It's a balloon that's got cold stuff in it. I'm kind of a simple guy, you know? So you're in the pulmonary vein. I think if you know anything about RF ablation, what they do today is they go with a little point tip catheter, if you think like the size of a pencil tip, and they have to go around point to point to point to point to point, like 50 times. This balloon allows you to go around that vein with one very easy approach. The clinical results were delivered at ACC in March. We had phenomenal results, 70% efficacy. The most exciting thing about this technology is there was some data presented at HRS. They looked at the learning curve. You got to realize that, imagine if I took these, the people in the front row, they'd never use this thing. They got it put in the trial. The first time they were using this product was in the trial. The learning curve on the first 5 patients, so if you'd only done 5, you had about a 48% efficacy. The trial was at 70. If you'd done more than 15, it was 90% efficacy at a year, 90%. A trial with a 90% efficacy in this patient population is a home run, blockbuster, game-changing technology. And the most important part is what this thing has done with patients. So with that, I'd like to bring up Heidi, who's the daughter of our patient, Gordy, and to tell us a little bit about the story. So Heidi, welcome. Okay.
Wow, what a privilege when to speak to all of you, because when I wrote this letter of thanks on behalf of my family to your president, Bill Hawkins, I thought he'd read it to you. If this doesn't put me into atrial fibrillation, I don't know what, but it's with great honor that I have the ability to read a shortened version of this letter to introduce my dad. I can't promise I can get through it. Thanks for the Kleenex. But without question, we put my dad's heart in your hands, and you have extended and enhanced his life. And we're so very grateful. So this is what I wrote. Dear Bill, sometimes things hit close to home. And this is one of those tender times. There are many of my tears in this. My invincible dad, a doctor who watches his health like a hawk, had been traumatized by his atrial fibrillations during the past decade. He vacillated between medications, and conventional ablation would be nothing he would contemplate, having been a pathologist and knowing all of its complications. In December, he met with Dr. Hamill and Dr. Doug Packer at the Mayo Clinic, and he knew things were descending for him. Dr. Packer told him of the cryoablation, and the freezing procedure intrigued him. It made great medical sense and seemed more safe and effective. He agreed to undergo the procedure in January. Bill, this is a rambling way to tell you how your Medtronic advances turn into victories for real people, like my dad, and me, who lives with a non-functional pancreas, and I depend on your Medtronic Paradigm real-time insulin pump and a continuous glucose monitor to live a normal life. Thank you. And please give my heartfelt thank you to all your dedicated Medtronic heroes who worked on the cryoablation for my dad, for my insulin pump and for my continuous glucose monitor, and for all the countless medical miracles that your company is revered for. All the best, Heidi. So, it's my great pleasure to introduce to you the new and improved version of my dad.
What a wonderful crowd. And thank you so much for inviting me to speak before you. And thanks also for the wonderful evening that you afforded me and my family last night, and the camaraderie and getting to know most of you, and hope to see you all again sometime. So I'm not used to talking about myself. I just don't feel right talking about myself, but I guess that's what I'm here for today. My story begins when I was born in 1935. The house you see on the slide is where I lived for the first 19 years of my life. It was built in 1904 on the south side of Milwaukee. My father lived there from age 3 to 93 when he died. I'm an only child. My mother was a stay-at-home homemaker. My father was a pattern maker at a large industrial complex, Nordberg Manufacturing Company in Milwaukee. In high school, I was interested in science and music. The choir director suggested that I take voice lessons. I don't know if he thought I sang so bad that I need him or what. But anyway, I did that, and subsequently, singing became an integral part of my life. When I was 16, I was a winning contestant singing an Old Man River at the Morris B. Sachs Amateur Hour, which was broadcast from Chicago's WENR TV and radio. I've been singing ever since. Jean and I, in the center, my wife, met when we were both in medical school. Because we were alphabetically close, she in LE and I in LA, however they divided the class, we were always together. There were only three females in my class, in comparison to nowadays, where 50% are females. I feel that I picked the best one in my class. She was a great supporter of me and my family. She gave up her career in pathology to stay home and take care of the kids. And I've got wonderful kids because of it, I think. And unfortunately, she's not able to be here because of health issues. We have been married, we will be married 51 years on Sunday, June 6th. Jean and I graduated from medical school 2 days later on June 8th, 1959. We had our internship and pathology residencies together in Madison. The photo is our graduation class. I was a pathologist and director of transfusion services at St. Mary's Hospital in Milwaukee for 39 years. St. Mary's was a tertiary care hospital with a very active burn center and a very active open heart surgical program. And during its peak, 1,000 open heart procedures were done in a year. World-renowned cardiac surgeon Dudley Johnson was our major surgeon. He, in my opinion, and opinion of others, is the father of coronary artery bypass surgery as we see today. My health has been generally good, other than for an injury in which I went through a window and cut my ulnar nerve. This makes me in continuous benediction. I had some minor back problems which required surgery, but other than that, after several years of palpitation and known atrial flutter, in 2005 I was diagnosed with paroxysmal atrial fibrillation. Symptoms included chest discomfort, some lightheadedness, anxiety. I was placed on sotalol. During this period of time, I discovered many atrial fibrillation triggers, which most doctors aren't aware of. MSG, caffeine, chocolate, aspartame or NutraSweet, alcohol, and food with high tyramines have triggered my atrial fibrillation attack. So I had to watch what I eat. As the frequency and durations of the episodes increased, in June of last year, 2009, I consulted with Dr. Stephen Hamill at the Mayo Clinic. At our meeting, we discussed ablation, but no decisions were no. He did explain, though, how the best results with atrial fibrillation ablation occurred in patients with paroxysmal atrial fibrillation, as I had, and those who had a left atrial size less than 5.5 centimeters, which I also had, so I fit for a possible. But no decisions were made. He did notice that I was on sotalol 80 milligram BID, and he thought, well, maybe if we increase the dose to 120 milligrams BID, it would have more success. Well, unfortunately, a month later, I had a minor stroke without lingering complications. I'm sure I threw a thrombus from my left atrium and resulted in it. I was placed on Coumadin therapy after the stroke, which I had fought off for years. Because my CHAD score was 1, I elected to be on daily aspirin therapy, and I was on that for many years. But now I had to be on Coumadin. Because of my stroke and increased frequency and durations of the paroxysmal atrial fibrillation attacks, I again consulted Dr. Hamill in December of last year. The options of RF and cryoablation were explained to me by Dr. Hamill and Laura Peterson. And as I met the criteria of the Medtronic sponsored CAP trial, I elected to participate in that trial. The lesser complications with cryoablation versus radiofrequency ablation and the expertise and international reputation of cardiologist Dr. Douglas Packer made the cryoablation decision easy. However, they wouldn't accept me until I read and studied this 15-page consent form. Explaining some of the good things that would happen to me, but 4 pages of what bad things that could happen to me, from a bruise, cardiac arrest, cancer, death, and all those good things. But in spite of that, I signed the consent. After that, they scheduled me for January 27, 2010, to undergo the ablation. I returned to the Mayo Clinic the day before for extensive testing. You can see on the chart what I had to go through. It was wonderful that they could do all these things there in such a short period of time and have the results in the afternoon for the doctor to see. I underwent the cardiac CT, transthoracic, and a esophageal echocardiogram. the latter to rule out any thrombi in the left atrium. If any were found, the ablation would have to be canceled. Fortunately, all the results were satisfactory. No thrombi were present. And following a final discussion I had with Dr. Packer that afternoon, we have both agreed to meet at St. Mary's Hospital in the morning for the procedure. Family and family members, my son David, my son-in-law Bill Rosati, and a friend Wally Marks escorted me to St. Mary's Hospital at 5:30 in the morning. I was admitted to my room in St. Mary's Hospital, and at around 7 o'clock, I remember them taking me out of the room to the procedure lab. And I remember entering this procedure lab for I don't know how many minutes I remember, but then I don't remember anything else. Until 4 o'clock in the afternoon when I awoke in my hospital room with many hovering around my bed, several holding pressure on both groins, somebody pulling the catheter out of this side of the neck, another one out of this side of the neck, pulling sheaths out of my leg. And after it was assured that I wasn't bleeding, they left. And shortly after that, Dr. Packer appeared to explain to me and the family what was done. He stated that during the procedure, a Medtronic 23mm aortic front balloon, including the freezer Mac cryo catheter, was used to ablate the 4 pulmonary veins. The atrial fibrillation that was present at the beginning of the procedure was terminated. He also ablated the cavo-tricuspid isthmus because of atrial flutter. The ablation was a success, and no complications occurred. He estimated that I had a 70% chance of no recurrent arrhythmias. 70%, that means 30% I wouldn't. Now, where will I fit? I'll tell you. At 10 o'clock in the evening, I walked the halls of St. Mary's Hospital for about 45 minutes, they said, conversing with the many dedicated nurses that were there to take care of me and the other patients in the room, on the floor. I was scheduled to be discharged the next day. But Dr. Packer said only if you passed another couple tests. He wanted me to undergo esophageal endoscopy and ultrasound so that he could rule out any potential injury to the esophagus. The esophagus is located immediately posterior to the left atrium, and so it is a candidate for potential injury, more so with the radiofrequency ablation due to heat, but potentially due to the cold of the cryosurgery. Fortunately, I passed those tests too. He said, go home. Unfortunately, he said, you can't go home to Loretto, Minnesota, where I was going, where my daughter lives. He said, you have to stay overnight in a hotel because I want to make sure that everything is all right. If some potential unsuspected complications occurred, I don't want you to be 150 miles away, so we can get you over to St. Mary's Hospital immediately. So what happened post-ablation? Since the Medtronic Arctic Frost cryoablation, the palpitations and other atrial fibrillation symptoms are gone. My diet is less restricted. I told you about my triggers. Dr. Packer picked that up. He walked into his room, to the room where I was waiting for him on my 3-month visit. What's the first thing he said? Have you had your MSG stress test yet? Well, now it's fun to even go out and eat. Before it wasn't. I'd have to quiz the waiters and everybody, are you using MSG or any other things that affect me? So now it's fun to go out to eat. And I had a fun night last night eating with many of you. And I ate a meat that I ordinarily wouldn't eat in a restaurant. And I'm still not fibrillating. Another thing, sotalol was examined. However, Coumadin has been continued. Today is my 125th straight day without any atrial fibrillation syndrome. I should say that on day 13, day 26, I did have a minor episode, which were very short duration, but it bothered me when, why not? I'm in the 30%, I thought at that time. But anyway, since that time, I've had nothing. So it's really 99 days without any evidence of atrial fibrillation or symptoms of it. What has this done to me? It's increased somewhat of my quality of life. It's giving me more quality time to spend with my family and other activities such as medicine, which I still, even though I'm retired, I still participate in it, photography, gardening, and music. Spent time with my grandchildren who live here in the Minnesota area. My oldest grandson, Dominic, will be a junior at Cornell College in Mount Vernon, Iowa. Stefano, will be a senior at Orono High School. He had recently had a great mentorship during high school with a professor at the University of Minnesota. My two youngest grandsons, sons of my son David, Christopher and Anthony, they are graduating from kindergarten to first grade next year.